Did you know that poor sleep in older adults is linked to memory loss, weakened immunity, and even heart problems? Sleep isn't just about feeling rested. For seniors, it's a critical part of staying healthy, sharp, and independent. In this video, Health 999 dives into why sleep matters so much for the elderly and how just a few changes can make all the difference. Why sleep is essential for seniors. As we grow older, our bodies don't recover quite like they used to. Muscles take longer to heal. Joints ache a bit more. Even our brain needs a little extra care. And guess what? Sleep is the magic reset button for all of these things. When we sleep, our bodies aren't just resting, they're actually hard at work. In older adults, sleep plays a few key roles. 1. Protecting the brain. Sleep clears away toxins that build up in the brain during the day. Studies from Harvard show that deep sleep helps prevent memory loss and slows the progression of diseases like Alzheimer's. Ever notice how a bad night's sleep makes it harder to focus or remember things? For seniors, consistent sleep issues can turn those little lapses into serious cognitive decline. 2. Boosting the immune system. As we age, our immune systems naturally weaken. But did you know, during sleep, your body releases proteins called cytokines that fight infection and inflammation? Older adults who sleep poorly get sick more often, and it takes them longer to recover from common illnesses like the flu or pneumonia. A good night's sleep is like giving your immune system a full tank of gas. 3. Reducing risk of chronic diseases. Heart disease, diabetes, stroke. These are some of the top health concerns for seniors. Poor sleep has been linked to higher blood pressure, increased blood sugar, and inflammation, all of which raise the risk for these conditions. In contrast, seniors who consistently sleep 7 to 8 hours per night have better heart health, more stable blood sugar, and lower stress hormones. 4. Maintaining balance and preventing falls. Here's something most people don't realize. Lack of sleep affects your reflexes and balance. Older adults who sleep less than 6 hours a night are at a 30% higher risk of falling, according to the CDC. For a senior, a fall can mean a broken hip or losing independence. Sleep literally keeps you standing strong. 5. Mood and mental health. We all feel cranky when we're tired. But for seniors, chronic sleep problems are tied to depression, anxiety, and loneliness. A well-rested brain produces more serotonin, the feel-good chemical that boosts mood. Getting enough sleep can be one of the simplest ways to feel happier and more connected. So, when you add it all up, sleep isn't just about feeling rested the next day. For seniors, it's about keeping the brain sharp, the body strong, and the heart healthy. It's about staying independent and enjoying those golden years to the fullest. Sleep truly is the best medicine. How much sleep do older adults need? So how much sleep do older adults really need? According to the National Institute on Aging, most adults aged 65 and older should aim for 7 to 8 hours of sleep each night. That's about the same as younger adults. But the difference is, as we age, getting that full amount of quality sleep becomes more difficult. Why is that? First, older adults tend to have lighter sleep. They spend less time in the deep, restorative stages of sleep. This means that even if they sleep for 7 hours, they may not feel well rested. Their sleep can also be more fragmented, with frequent awakenings throughout the night. Second, the body's circadian rhythm, or natural sleep-wake cycle, can shift with age. Many seniors find themselves getting sleepy earlier in the evening and waking up earlier in the morning. This change can sometimes lead to early morning awakenings, even if the person didn't get enough sleep yet. Third, physical discomfort or health conditions, like arthritis, back pain, or bladder issues, may lead to frequent nighttime disruptions. Some medications, such as those for high blood pressure, anxiety, or depression, can also interfere with sleep. In other words, while 7 to 8 hours is the recommended amount, achieving that sleep can be more complicated in later years. But here's the key: it's not just about how long you sleep, it's about how well you sleep. A person who sleeps 6.5 hours but feels refreshed, alert, and mentally clear throughout the day may actually be in better shape than someone who sleeps 8 hours restlessly and wakes up groggy. So, how can you know if you're getting enough good sleep? Pay attention to how you feel during the day. If you're often feeling drowsy or fatigued, struggling to concentrate, falling asleep during quiet activities like reading or watching TV, relying on caffeine to stay awake. Then your sleep may not be as restorative as it should be. Some seniors also try to catch up on missed sleep by napping during the day, but long or late day naps can actually make it harder to fall asleep at night, creating a cycle of poor nighttime rest. Short naps, under 30 minutes, can be beneficial, but regular, consistent nighttime sleep should still be the main focus. If sleep issues persist for more than a few weeks, it's important to speak with a doctor or sleep specialist. Sometimes, conditions like sleep apnea or restless leg syndrome are the underlying cause and can be treated effectively. Remember, sleep is a form of medicine. It helps the brain store memories, the heart recover, and the immune system stay strong. For older adults, getting enough quality rest isn't just nice, it's necessary for long-term health and independence. Common sleep problems in seniors. As we age, sleep becomes more fragile. It's common for older adults to experience changes in how well they sleep. But just because it's common, doesn't mean it's healthy. Let's look at some of the most frequent sleep issues seniors face, and why they matter. 1. Insomnia. Insomnia is one of the most common complaints among seniors. It includes difficulty falling asleep, waking up during the night, or waking up too early and not being able to go back to sleep. For many older adults, insomnia is connected to other health conditions, like arthritis, chronic pain, depression, or anxiety. Certain medications can also interfere with sleep, including those for high blood pressure, asthma, and even over-the-counter cold medicine. Chronic insomnia doesn't just make people tired, it can lead to poor concentration, irritability, and a higher risk of falls and accidents. 2. Sleep apnea. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep. Many seniors don't even know they have it, they just feel exhausted during the day, despite spending enough hours in bed. Symptoms include loud snoring, gasping for air, dry mouth in the morning, and morning headaches. If left untreated, sleep apnea can increase the risk of high blood pressure, stroke, heart disease, and type 2 diabetes. The good news: it can be diagnosed with a sleep study and treated with methods like CPAP machines or lifestyle changes. 3. Restless leg syndrome, RLS. RLS causes an uncontrollable urge to move the legs, usually due to uncomfortable sensations, especially at night. Seniors with RLS may toss and turn, constantly moving their legs to relieve the feeling. This condition disrupts the ability to fall asleep and stay asleep. It may be linked to iron deficiency, kidney disease, or neurological conditions, and it's more common in older adults. 4. Frequent urination, nocturia. Waking up several times a night to use the bathroom is another sleep disruptor in seniors. This could be due to enlarged prostate in men, bladder issues in women, diabetes, or simply drinking too much fluid in the evening. Interrupted sleep from frequent bathroom trips can leave older adults feeling groggy and unfocused during the day. 5. Circadian rhythm changes. Aging affects our internal clock, known as the circadian rhythm. Older adults tend to get sleepy earlier in the evening and wake up earlier in the morning. This shift can lead to early morning awakenings and difficulty staying asleep through the night. Some may also experience advanced sleep phase syndrome, where they fall asleep very early and wake up around 3 or 4 a.m. 6. Daytime napping. While short naps can be beneficial, long or frequent naps during the day can reduce the body's natural drive to sleep at night. This creates a cycle of poor nighttime rest and excessive daytime sleepiness. In short, sleep problems in seniors are real, and they matter. They affect not just how a person feels, but how they heal, think, and function every day. In the next part of this video, we'll share proven tips to help older adults sleep better, naturally and safely. Tips for better sleep. So, how can older adults get better sleep, the kind that truly restores the body and mind? Here are 8 simple but powerful tips, backed by sleep experts and medical studies, that can help improve sleep quality, especially for seniors. 1. Keep a consistent sleep schedule. Try going to bed and waking up at the same time every day, even on weekends. This helps regulate your internal clock, or circadian rhythm, which becomes more sensitive as we age. A consistent routine trains your brain to know when it's time to sleep and when it's time to be alert. 2. Create a sleep-friendly environment. Your bedroom should be cool, dark, and quiet. Consider blackout curtains to block outside light, and a white noise machine if you're sensitive to sound. Make sure your mattress and pillows are comfortable and supportive, especially for aging joints and backs. A calm space tells your body, it's time to rest. 3. Get natural sunlight during the day. Spending at least 30 minutes in natural light, especially in the morning, helps keep your circadian rhythm on track. Light exposure during the day improves nighttime melatonin production, the hormone that signals sleep. Even a short morning walk or sitting near a sunny window can help. 4. Stay physically active. Regular exercise during the day, like walking, stretching, tai chi, or water aerobics, promotes deeper, more restful sleep. But avoid intense workouts within 2 hours of bedtime, as that can be too stimulating. 5. Avoid caffeine and alcohol in the evening. Caffeine stays in your body for hours and can keep you awake even if you don't feel it. Try limiting coffee, tea, or chocolate after 2 p.m. And while alcohol may help you fall asleep faster, it disrupts your deep sleep later in the night. 6. Limit naps to 20 to 30 minutes. A short nap can boost alertness, but long or late afternoon naps can interfere with nighttime sleep. If you nap, try to do it before 3 p.m. and keep it brief. 7. Wind down before bed. Develop a relaxing bedtime routine. Reading a book, listening to soft music, taking a warm bath, doing gentle stretches or breathing exercises. Avoid screens, like phones or TVs, at least 1 hour before bed. Blue light tricks your brain into thinking it's still daytime. 8. Talk to your doctor if needed. Sleep problems can be signs of other conditions like sleep apnea, restless leg syndrome, or even medication side effects. Don't ignore chronic sleep troubles. Professional help can make a huge difference. Remember, better sleep doesn't happen overnight, but small daily habits add up. And the benefits: clearer thinking, better mood, stronger immune health, and even lower risk of falls or heart problems. Sleep is not a luxury, it's one of the most powerful tools we have for healthy aging. A good night's sleep can improve memory, boost mood, protect your heart, and even reduce your risk of falling. It's something we often take for granted when we're younger, but as we age, sleep becomes more fragile and more precious. If you or someone you love is struggling with sleep, don't ignore it. Small changes in daily routine, environment, or even diet can lead to real improvements. And when those changes aren't enough, talking to a healthcare provider is the smartest step. At Health 999, we believe everyone deserves restful nights and brighter mornings. Because better sleep doesn't just help you live longer, it helps you live better. So tonight, ask yourself, are you giving your body and mind the rest they truly need? If this video helped you think differently about sleep, give it a like and subscribe to our channel. We're here every week with new, science-backed health tips for seniors, caregivers, and families. All delivered with care, compassion, and clarity. Thanks for watching, and sleep well.